Good morning, everybody. Uh, I wish I was not here. We all are tired of COVID, and I'm tired of COVID. And I think it's totally understandable that people are frustrated. We were making a remarkable progress in our country, and in great part, we were making remarkable progress because of vaccinations. Vaccinations were really doing well, and we were making incredible progress. Cases were coming down. But something changed over the last month, and what changed is the emergence of the Delta variant. The Delta variant, as CDC has said, changes the game. It really changes the game, and it does that because this variant is highly transmissible. It's about 60% more transmissible than prior variants, and what that means is that you're more likely, CDC has said it's as transmissible as chickenpox, and maybe some of you didn't have chickenpox, but those of us that had chickenpox, we know that our parents, if somebody had chickenpox, the rest of the kids in the family had chickenpox because it's that transmissible. It's not something you can stay away from. And that just tells you the difference in the past variant is that if one person was infected, that person led to about 2.5 to 3 people getting infected, and those people then 2.5 and 3, and so on and on and on. With the new variant, it's about one person infects 6 to 8 people. And then each one of those infects 6 to 8, and you go on, and that causes this very rapid rise that we're seeing. It's almost like a rocket. This exponential growth is because this rapid transmission. What we know is that what has not changed, though, is that the vaccines continue to be very effective. And while you have read that there's so-called breakthrough cases, they are still uncommon. And if you see in the Georgia Department of Public Health website, they publish some very useful information that I want to highlight. Of the about 4 million people vaccinated in the state, there have been close to 5,000 people who've tested positive. 118 have been hospitalized, and just 24 have died of COVID. Thus, if you're fully vaccinated, if you receive your 2 doses, your risk, and you've done 2 weeks after your 2 doses, so you let your body the time to produce the immunoglobulins, et cetera, your risk of being hospitalized or die from COVID is about 0.002%. So it's about the risk you have about, walking outside and getting hit by lightning. It's pretty low. So I want to emphasize your best protection against this Delta variant is vaccination. And as the mayor said, get yourself vaccinated. We, as a country, about 50% of people have been vaccinated. That means we still have about 90 to 100 million Americans who are eligible for vaccination and have not yet been vaccinated. Here in the state of Georgia, we're lower than the national average. We're better in the city of Atlanta, but we're still not where we need to be, and therefore we need to tell everybody, get vaccinated. You should have been vaccinated a month ago to be protected, but even getting vaccinated today is still useful and will protect you against COVID. I want to say that, emphasize that in the hospitals, we're seeing an increase in hospitalizations across the state. 97% of hospitalized patients have not been vaccinated. So again, it is really the vaccines that will protect you from getting hospitalized and dying. On July 27, the CDC recommended that everyone who is in a high area for COVID transmission starts wearing a mask indoors in spaces, regardless of their vaccination status in public spaces. CDC defines as high, and you can see the map of, red is high. It's any place where there's more than 50 new infections per 100,000 residents or more than 8% test positivity rate. Here in Fulton and DeKalb, our new cases are actually not at that level. They're about 25 per 100,000. But our test positivity is over 8%. Is closer to 9.5 to 10% in both places. That's why CDC has designated us high areas of transmission, because the test positivity rate is high. And that's the reason why it is recommended that people wear masks. Masks, do help stop the spread. The main reason, though, that we wear a mask is to protect others, primarily the unvaccinated, from getting infected. And this includes, as the mayor said, kids under the age of 12 who are not eligible for vaccination. So by me wearing a mask, if I have kids at home, I'm in a way protecting them. So masks do help cut down coronavirus transmission, but it's really vaccines that offer the best protection. So I want to emphasize that over and over. We need to do, and there's been so much vaccine misinformation that we need to just stop that and just tell people. And this morning I was very pleased to see New York Times Secretary Azar, former Secretary of HHS Azar, say in an op-ed, vaccines are not Republican or Democrat. Vaccines are needed for everybody, and everybody needs to be vaccinated. And again, we all need to say, get vaccinated as soon as you can. And if we do that, I think we'll turn the corner on this pandemic.